Picture this. A workplace emergency has just erupted right on your factory floor. It's chaotic, it's incredibly loud, and every single second of hesitation is literally draining the life from your colleague. Well, in this explainer, we're not dealing with hypotheticals. We're plunging straight into the terrifying, high-stakes reality of a critical incident. We're going to break down the absolute core purpose of first aid.
4 minutes. That's it. That is exactly how much time you have before an obstructed airway causes permanent, irreversible brain damage to that colleague on the floor. The clock starts the exact moment they go down. Every single tick is a countdown to a permanent tragedy. And you know, that extreme, intense pressure, that's exactly why things so often go wrong.
Because let's be honest, most people completely freeze in these high-stakes situations, right? They panic. They're absolutely terrified of doing the wrong thing. Terrified they're going to make the injury worse, or maybe they're worried about exposing their company to severe legal liability. But here's the reality. Paralysis costs lives. It ruins businesses, and it opens the door to massive compliance disasters. Doing nothing, that's actually the most dangerous action of all.
So, let's dive into the ultimate solution to this bystander paralysis. It all comes down to mastering 3 simple pillars: preserve life, prevent further injury, and promote recovery. Once you get these down, you're going to know exactly how to take immediate control of any chaotic scene. You'll be able to confidently protect your team and make absolutely sure you're maintaining strict workplace compliance.
Let's start with Pillar 1, preserve life, and protect both yourself and the patient.
Now, preserving life sounds pretty obvious, right? But there is a massive, incredibly dangerous catch that untrained bystanders almost always miss. And it's this. Preserving life actually has to begin with your own safety as well as the safety of anyone else at the scene. Think about it. If you rush blindly into a hazardous workspace, say, I don't know, there's a toxic chemical spill, a live electrical wire, or even a collapsing structure, and you get injured yourself, well, you've completely failed. You haven't preserved life at all. You've just added a brand new patient to an already critical scene. So before you touch anyone, you absolutely must equip your personal protective equipment. Throwing on disposable waterproof gloves and using a CPR pocket mask ensures you prevent cross-infection. Remember, you cannot help anyone if you become a casualty yourself.
Okay, so once you are completely safe, your immediate focus shifts right to the patient. You need to conduct a primary assessment to check the ABCs: airway, breathing, and circulation. Obviously, humans need to breathe and circulate blood to survive. If they don't have a clear airway, or let's say they're bleeding catastrophically, you have to intervene right then and there with life-saving treatments, like starting CPR or applying direct pressure to a wound.
Now, stopping a catastrophic bleed or jumping into CPR is a fantastic, necessary response. But what if the environment itself is actively killing the patient? Because stopping a bleed is literally useless if you just leave the patient sitting in a deadly situation. And that brings us directly to our next crucial step,
Which is Pillar 2, prevent further injury by securing the scene.
Especially in a commercial or industrial setting, hazards are absolutely everywhere. Your mandate here is to actively prevent the patient, yourself, and any of the bystanders from sustaining additional harm while you wait for professional help to show up. To do this flawlessly, we use something called the HHH framework. First up is hazards. You need to ruthlessly assess and lock down the scene. Next is hello. Just introduce yourself to the conscious patient, clearly state that you're there to help, and get their consent. And what's really fascinating here is that simply introducing yourself actually acts as a medical intervention. Just reassuring the patient naturally stabilizes their physiological stress. It literally lowers their heart rate and calms their breathing. And finally, the third H is help, getting the real professionals on the way.
A really big rule of thumb here. If there is no immediate environmental threat, do not move the patient unnecessarily. Just leave them exactly where they are. Moving a patient improperly can actually worsen undetected spinal injuries, or it could turn a relatively simple fracture into a permanently debilitating injury. So unless the environment itself is about to kill them, keep them totally still.
Now, obviously, keeping them safe on the floor isn't going to magically fix the underlying medical crisis, right? And this is exactly where we see a huge difference between amateurs and professionals. An amateur, they'll attempt a full-blown medical diagnosis and try advanced procedures, which risks a total legal catastrophe. A certified professional, on the other hand, does exactly what they're trained to do, and not a single thing more. They stabilize, they immobilize, and they quickly refer to EMS. Basically, you are not a doctor, and you shouldn't try to be one.
This leads us perfectly into Pillar 3, promote recovery by stabilizing and referring the patient.
As I just mentioned, this final pillar definitely isn't about performing surgery or handing out prescription meds. It's really just about stabilizing the patient while you secure backup. To promote recovery, your core objective is simple: apply your specific first aid training to keep the patient as comfortable as possible and reduce their pain, maybe by stabilizing fractures or dressing open wounds. Reducing pain actually actively promotes their physiological recovery, which is pretty amazing. But listen, the absolute biggest mistake untrained bystanders make is hesitating to call for backup. You've got to seek professional help early. Never, ever leave a critical patient unattended. Instead, take absolute command of the situation. Literally point to a specific bystander and explicitly assign them to call the South African National Emergency Medical Services at 10177 or the police at 10111. Make it their job. All right, so while you wait for that ambulance to arrive, the clock is still ticking. You have to transition into what's called a secondary assessment to find any hidden injuries. This means you systematically check their vital signs, you assess the patient's pupils, and you keep very accurate written records of their condition. And let me be clear, this isn't just busy work to pass the time. This documentation is entirely non-negotiable.
Because all of this leads into our final stage, the handover, compliance, and securing the chain of custody.
See, when the paramedics finally arrive, you cannot simply step back, throw your hands up, and wash your hands of the whole situation. If you exceed your trained scope of work, or if you fail to properly pass on the information you've gathered, you actually break the chain of custody. Doing that completely invalidates your workplace legal protections and immediately exposes your entire organization to severe compliance violations. So to protect yourself, you must perform a structured handover. First, give the EMS team the patient's demographics, like their name and age. Then, and this is crucial, explain the exact mechanism of injury. Understanding exactly how the injury happened allows the EMS team to apply the right immediate life-saving responses. Finally, detail any suspected injuries you found, the specific signs you recorded, and the exact treatments you applied, along with the times you applied them.
It's important to realize that this structured handover is way more than just a quick medical briefing. Having rigorous documentation and solid communication guarantees a seamless transition of responsibility. Accurate record-keeping actually proves that you acted correctly and within your scope of training. It protects the confidentiality and the dignity of the patient, and, maybe most importantly for you, it completely shields you and your employer from liability if there's ever an official investigation later on.
So what does this all mean for us? The crucial takeaway here is this. Do not let your company's safety protocol become a massive liability. Ask yourself right now, is your workplace fully compliant, completely protected, and genuinely prepared for the absolute worst-case scenario? Because if you aren't 100% sure, then it's time to act. Implement these standards, secure that chain of custody, and get your designated responders certified today so they never freeze when lives are actually on the line.